I'm smiling, even
Excellent.
though the photograph won't show.
Yeah, thank you. Now, first, I would like to ask for your both permission to use this video for educational purpose and on
Yes.
internet.
Yes.
So, tell me about your problems before the surgery.
Well, a good friend of mine who lives in Arizona
Mhm.
and goes back and forth there to California had dealt with a surgeon in California where they opened him up and moved his intestines and so on and so forth. And to me, I was very apprehensive about that,
Mhm.
and because of
Did
that.
you have similar problems? What were your symptoms?
Well, I don't think he had scoliosis, but just the
Mhm.
general back operation.
Mm-hmm.
And he shared that with me, and I said, I'm gonna wait until
Yeah.
they approve
Yeah.
things. And I waited for like 3 years.
With
before
pain,
even-
you had pain, correct?
I
For
did.
3 years you had pain. How
I
bad
dealt
was
with
the pain?
Yes.
How bad was the pain in that 3 years?
I have
How bad?
somewhat of a hearing problem.
How bad was the pain in that 3 years?
It was, I would call it, it's not the same pain all the time, but it was
When it was
very,
bad?
very noticeable.
Yeah, very noticeable. Now, how was your life in that 3 years? Could you do things you like to do, or?
There are some things that I would not do. For
Mhm.
example, if my wife said, "Oh, let's walk the dog,"
Mhm.
and we live at the end of a cul-de-sac
Mhm.
and have a street that goes up, and I'd walk the upward part is maybe 500 yards,
Yeah.
and I got very painful where I
Mhm.
had to turn around and walk back home.
And what did you notice in that time frame? How was his life?
Oh, he used to be an excellent tennis player. He
Mhm.
stopped playing tennis. He stopped playing golf.
Practically stopped living
He
life, you
stopped
know?
living life.
Well, tennis,
Yeah.
I had rotator cuff surgery.
Okay.
Well, but you couldn't play tennis with
Yes.
your back.
Yeah.
Yeah.
Okay.
And
So, and what we noticed, you have a scoliosis, and you didn't have a little scoliosis. You had a cob angle, meaning the side bending of the spine, 35 degree, and multiple bad discs. And we noticed that you do need a surgery, but the alternative for the surgeries are open,
Yeah.
old-fashioned way or minimal invasive. And you
Yes.
described what we call OLLIF, anterior lumbar interbody fusion, with your friend, that we open up the belly, we push the entrails and the guts and vessels to the side, we go from the front, fix it, then we turn you back and fix it from the back. That is easily a whole day surgery,
and it
easily.
took him a year to recover.
That's what you have been told, or
Yes,
your friend
yes,
told you?
His back is okay now, but it really took a whole year.
A whole year to recover from
Right.
that surgery, your friend. Now, you're just sitting there, and you don't look like somebody who got a scoliosis surgery just less than a month ago. No, our surgery was about a month ago, right?
Mhm. Yes.
Okay.
I forget the date. Linda,
Yeah.
remember the date?
It was about the 9th.
Yeah, so about a month ago now. How long did you stay in the hospital?
One night.
Yeah.
You stayed one
Very
night?
short period of time.
Yeah, one night. Yeah, and you told me that
I
next
came
day.
into the room to pick him up, and he was sitting up, and he had his bag packed, and that was
Mm-hmm. Yeah.
at about 11 o'clock in the morning after his surgery
Yeah.
the next day.
Yeah.
It's
I'm
amazing.
ready to go home.
So
Yeah.
within a day after scoliosis surgery,
Yep.
and these are your films. I'm just turning around. We did a 3 level fusion scoliosis correction. Obviously, we aimed for those levels that are causing most of your clinical symptoms. And if you look here are the screws that we put in. And with our technique, we could put those screws in a way that the screw is actually filling the entire space. With those double C-arm, we are very accurate. Practically the screw is dead center to the what we call pedicle in all levels. And we could do that because we use 2 C-arm, and our OLLIF technique and protocol that we use, it looked fantastic. And that I just measured the cob angle between this bone and this bone. It is about 9 degree down from 35 degrees. So what do you notice? I mean, you told me about something that you noticed, that he's not crooked anymore. Tell me about it.
He looks fantastic. He looks like he's never had a back problem.
Yeah.
I thought with his hunch over to
Mhm.
the right side, I thought that's what we were going to live with for the rest of our lives.
But
And it really changed our lives, and we stopped doing everything. And my brother has had 2 back surgeries. He's
Mhm.
60 years old. he cannot feel his, from below his knee.
Yeah.
And he said to us when he kept saying, well, how's Mark's back? I said, he's getting better. And I said, it's amazing. I said, his shoulders and everything. And he said, boy, is he lucky. He said, I need Dr. Abbasi's number.
Yeah.
So,
No, but you as well noticed that, when you walk more straight, and people have noticed that. Tell me about it. How do you notice that you're walking straight?
Well, as I shared with you, the biggest thing was we have about 400 or 500 yards going uphill from our home, which is at the end of a cul-de-sac.
Okay.
I'd walk the dog, and I'd walk up this incline, and it was maybe 400 yards long would be a guess. And I'd get toward the top of the incline, and I couldn't go any further, and I had to turn around and go back home.
Okay.
but now he's up walking around all over the place.
So
in the
walking is
yard.
not an issue anymore.
No.
You noticed as well, you told me something about your shadow. When you walk, when you see your shadow, tell me
Yes.
about it.
If I did it at a time where the sun was shining through the trees, and this was before all the leaves were out, it was very noticeable before that when I was walking up the hill, my left shoulder would be very meaningfully lower than my right shoulder.
Well, 35-degree carb angle is significant. Yeah, go
And
ahead.
Now due to your wonderful surgery, it squared up my shoulder.
Good.
I still have some of the indentation in my left waist. The scoliosis is still there to a certain extent, but apparently that it has improved since due to the surgery.
Yeah, fantastic. Now, obviously, walking and daily activities are important. The fact that you left the hospital within 24 hours is important. And we just look at the surgical record. For this scoliosis surgery, our blood loss was just few ounces, less than half a cup, coffee cup. And, our surgery time was, with all this twisting and bending of your spine, was only 79 minutes, which is not even 1.5 hours. Which is fantastic for what we really achieved in that 1.5 hour.
You were very smart to put together an infomercial, which I found to be your infomercial, and my wife saw it also. She has a master's in public health and is very good at
Excellent,
was a wonderful partner to.
Then you understand the terms better, actually.
She understood it better
Well,
than I did.
All of her friends kept saying too, oh, you really need to get a second opinion. And I said, no, we don't need a second opinion. We do not want to muddy the water. I said, we're very, very confident.
Yeah,
Dr. Abbasi.
but nevertheless, in my protocol, I always recommend second opinion because I think there's nothing wrong with getting second opinion. And on top of that, a surgeon or a physician who is concerned about the second opinion, I think that's even more reason for you to get a second opinion.
You did encourage us to do that.
Yeah, I
did
encourage
have a cousin-
everybody.
I have a cousin that's a neurosurgeon. I called her out in Pennsylvania. I said, this is what we're doing. And she said, we do this surgery too. And she said, it is very successful surgery. And that's when I came back and talked about L1 and whether we needed to
Excellent.
do that.
That was effectively almost like a second opinion.
Yes,
With her
yes,
talking with
exactly.
her cousin. She.
But I didn't even know anybody else to go to that
Does
did
she
this type
live
of
in
surgery.
Atlanta, Georgia?
She lives in Augusta.
Augusta, Georgia.
Yeah. Well, hopefully you can give an update to her about what the situation is. And overall, we are just about a month after this big scoliosis surgery. Most of my patients notice after this kind of surgery, most of the improvement is actually in the second month. So hopefully in the next month to come, you'll notice you can do more and your life improves and so on. But still, obviously, healing can take weeks and months after the surgery.
Well, what was really important is the fact that you were patient enough with me to have my wife and I come, sit down with you, ask a lot of questions. And because all of your answers, with the advantage of hindsight, looking at what we discussed there, was very, very accurate.
Well, I think it's important to know exactly what you're getting into. These are important decisions, and these are not easy, sometimes very technical kind of terms and situations that we have to explain. So we especially take pride in, make sure that our patient truly understand what they are getting into.
Well, I think also two things, your literature that you gave us before the surgery, exactly what we needed to read, and so we could come in with questions for you if we had anything that we're concerned about. Also, the other thing is Fairview Hospital out here in Burnsville, unbelievable.
Well, I'm very happy to hear
We were
that.
very impressed with it.
Yeah.
I will forward it to them. I'm sure they will be happy to hear about that, okay?
Well, it had that smaller, but being smaller, it felt like that they were paying more attention to helping me to
Fantastic.
improve.
I'll forward it to them. They'll be happy to hear that. Now, well, thank you so much for the interview. And, do you have any question or other comment that you would like to add?
No, I guess our only question now is whether he can swim. What can he do right now? If
Yeah.
he should still stay out of a pool
Well,
or?
No, you
Swimming
can.
down the road, golf. I used to play golf a lot, but I'm not going to. But what are
Well,
your
they say life is
suggestions?
fine, golf is serious. So those heavy twisting long shots are going to be probably still, you have to be careful with them. So, everything else, start it slow and add to that. Like swimming should be fine.
Good.
We have
Okay.
a pool at our home, so
There you are,
perfect
so
place for
Put it to good
therapy.
use.
Yeah,
Put it
the
to
dog
good
gets
use.
the most use of it right now.
Good for the dog. So, yeah, thank you very much for the interview.